So did you know that 1 in 4 women birthing people will struggle with a maternal mental health diagnosis? And that number is actually doubled. Research has found that that number is actually doubled for Black women. So some researchers have found that about 40 to 50% of Black women will struggle with the maternal mental health diagnosis. So that's anxiety disorders, that's a type of mood disorder. And unfortunately, because of stigma, because of societal racism, Black women aren't getting the help that they need and deserve. My name is Karen Balumbu Bennett. I'm a licensed clinical social worker based out of Long Beach, California. I have experience doing therapy, mental health therapy in a lot of different arenas. I've worked in community mental health. I've worked with victims of crime. I've worked in emergency response teams, so mental health emergency response teams. So if you're having like a mental health crisis, there's therapists that will come out, assess, and possibly place you on a hold or not. And I also recently work for a school district, and I have a private practice where I specialize in maternal mental health. I specialize in maternal mental health and more specifically perinatal mental health. So that is when someone conceives up until the first year of birth. And that's a very special, vulnerable time. And so we've learned that we have to give it extra care and extra support. I also specialize in supporting individuals who are struggling with fertility challenges. So that could be anywhere from someone who has maybe an actual diagnosis to people who are undiagnosed and they don't know what's going on, but they can't get pregnant, possibly even experiencing recurrent pregnancy loss. So for me personally, mental health and maternal mental health is really important because I've witnessed in both professional and personal life that women birthing people really have a difficult time. And there's so much positivity in the media, and it's great, but it's not always reality for most people who are going through the grind of being new parents, being new moms. And so it was really important for me to transition and to start to focus and specialize in that, especially after having my own daughter and just realizing how challenging it could be. Even though I wanted her so bad, I struggled with fertility challenges. But once I had her, I realized that I really needed support. I needed community. And so I think that I say that I birthed my daughter, but I also birthed my specialty. I do not believe that maternal mental health is discussed at the level that it should be discussed. I do think that we're having a new wave where people are wanting to be more vulnerable and transparent and share. There's incidents that are making attention in the media, grabbing the attention of the media. And so we are starting to hear more about maternal mental health, but I do believe that it's a topic that people have shied away from because just like mental health in general, there's a stigma attached to it. So people are afraid to share about their mental health challenges. And then when you add maternal mental health onto that, there's a lot of fear that comes with that as well. One, the media makes us feel like we have to be always happy and enjoy motherhood. We shouldn't have any qualms with it. And so if you're experiencing that, you may feel really isolated or ashamed. And then two, there's like this fear of, will people take my child away? Am I going to be considered incompetent if I disclose that I may be having some anxieties or I'm having some recurrent negative thoughts or I feel depressed? And so a lot of people tend to, unfortunately, deal with it in isolation. So whether you're struggling with fertility challenges or even you're just a new mom and you're having some negative thoughts and you're struggling with just feeling happy, I always recommend trying to get some professional help. You could even just start with maybe just confiding in someone that you find to be a great listener, someone who won't minimize what you're saying. A lot of times, the people in our life that love us and we love, they are uncomfortable with us sharing difficult, sometimes dark thoughts. And so they may just try to focus on the positive and have a hard time really hearing. So if you want to start with just maybe externalizing how you feel, please try to find someone who is able to hear you. And then I would definitely say the next step, if you can't do that, or if you want to skip that step altogether, professional help. You can definitely find a therapist. There's individual therapy, there's group therapy, Now after COVID, there's online therapy, readily available, way more than before. And so there's different ways that you can get the type of support that you really need to make sure that you don't go through this journey or this difficult time alone. I always say that it's really important to manage your mental health. And you want to manage your mental health by being intentional. So just like we try to manage our physical health by watching what we eat, making sure we're going to our doctor's appointments, exercising, resting, that's the same thing you want to do with your mental health. And if you do this, you can most times avoid mental illness. So by managing your mental health, you are just prioritizing your overall emotional and mental wellness. So some of the things that you could do, you can journal so that you don't let negative things build up. You can make sure that you're being mindful and just trying to be in the present, because a lot of times when we are thinking too much about the past, that can spark some depression, or if we're too forward focused and worried about the future, that can keep us in an anxious space. So trying to ground ourselves and being present and practicing gratitude. Also, our physical health and our mental health are interconnected. So exercising is a great way to make sure that you are staying on top and prioritizing your mental health. So making sure that you're exercising, it doesn't have to be anything ridiculous. It could be walking here and there, jogging, yoga. But again, the key word is intentionality. You have to be intentional about making sure that your overall well-being is prioritized. So there is a stigma with mental health and receiving support, especially in the Black community. I really like to focus on the fact that Black people for a very long time were refused the right to medical help in general. And we as a community had to really hide our needs in order to just provide and not show people that we were struggling. So what we have found and research has found is that although Black people are struggling with getting professional help, they really benefit from it, especially in group therapy, which really makes sense to me because we really do benefit from community. And so we really do benefit from being in spaces with other people who share similar stories, who can give us some feedback, who we could bounce ideas off of. And I really want to encourage Black people who maybe, even if you're a little hesitant with therapy and you don't know if you want to do individual therapy, start with group therapy. That may be the place for you to start. It may be scary, but we've really found that those spaces help us really grow.